So erectile dysfunction is a persistent inability to achieve erections that are adequate for penetration. And the key when we think about erectile dysfunction is that it's something that's bothersome to men. Erectile dysfunction is extremely common. About 50% of men over the age of 50 have erectile dysfunction, and we now know just through the patients that we're treating that even men under the age of 50 are afflicted with erectile dysfunction. In fact, far higher quantities than I think we previously appreciated. In the United States right now, about 30 million men are suffering from ED, and we know that there's so many men who are not coming forward that do have this issue. So really, that number probably far underscores what the full gravity of this issue. So erectile dysfunction is caused by a variety of issues. One of the major issues are actually vascular causes. Conditions like hypertension and diabetes really affect your blood vessels, and this affects the ability for blood to effectively reach your penis to have a good erection. Another big category are hormonal issues. Conditions like low testosterone can also impact your ability to have good erections. Surgically induced ED is also a big category. For men who get surgeries like taking your prostate out and other pelvic surgeries, that actually can impact the nerves that are directly responsible for erections, and that can cause erectile dysfunction. There also are a variety of medications that can cause erectile dysfunction, such as some antidepressants, some antihypertensives. So those are important things to think about when we're evaluating men for erectile dysfunction. There's also nerve-related issues, in addition to surgeries, other conditions that affect your nerves, such as diabetes, can also impact your ability to have strong erections. And then finally, there are some psychological induced causes of erectile dysfunction. So diagnosis of ED is really from the clinical history. And so when I'm talking to guys, asking them about their erectile dysfunction, it really is about how it's impacting you. Some men are pretty satisfied with the quality of their erections, but if you notice a change in your ability to have penetrative intercourse, if you notice that there's been a change through the years, that is dysfunction, a change from your baseline. So it's diagnosed just from history and men just knowing their bodies and knowing that there's been a change in their erections. ED can be prevented. The things that you do to your body when you're younger really impact you later. I really emphasize, lifestyle modifications and, just a good holistic approach to thinking about erectile dysfunction. I will say that once you get to the point of having some dysfunction, it's highly unlikely that you may get back to your baseline, but keeping a well-balanced plant-based diet, regular moderate exercise, those are really important to maintain the quality of your blood vessels and ultimately the quality of your erections. The benefits of seeing a specialist for ED are also multifactorial. There are a lot of great physicians who know kind of the basics of managing ED, particularly with medical management. However, a lot of men are not either candidates for medical management or they're seeking something more, especially permanent solutions for erectile dysfunction. Someone like myself, who is an expert in erectile dysfunction, I think we can really partner to think about what are your goals in terms of your sexual health and your quality of life. And I think it really is important for you to have all those options available. Someone who's not a specialist in erectile dysfunction may not be as well versed with all of the options and incorporating that into your care, particularly with the surgical options. So I think it is important to see a specialist, and I think that's really going to be the best way to reach your goals. So there are actually several treatment options for erectile dysfunction, and that I think also really makes it exciting to think about. If you have this issue, there's lots of things you could do for it. Medications, oral medications are one of the most common treatment options. So I'm sure if you've seen commercials for Cialis or Viagra, they're part of the same drug class, and those help you to maintain erections once you're actually aroused. Works for a lot of guys, not for all. And so that's something that I would say most people that treat ED will offer you. Another treatment option is something called an intraurethral suppository. It's actually a medication that goes inside your urethra that actually absorbs into the tissues of your penis to allow you to get an erection. Advantage is there, it's not metabolized through your whole body. So if you're someone who may be not responding to oral medications, that could be something that's effective. Vacuum erection devices are also work really well for erectile dysfunction, and that's really a mechanical way of pulling blood into your penis and maintaining an erection there. Another common and really effective way to achieve erections is actually also through intracavernosal injections. This is something you would administer to yourself at home just prior to sex, and this also can result in a pretty potent erection. Usually the dosings in that have to be coordinated with a urologist or an ED expert to really see what dosing works best for you. And then finally, the gold standard for erectile dysfunction is a penile implant. This is a one-time surgery that really allows you to have full control of your erections and really to give you a reliable on-demand erection when you want, and it's a great option for a lot of men. The way I determine the best ED treatment for my guys is also through shared decision making. Once I really go through all of the options with my guys, I really have to gauge what your comfort level is. All of the options I've discussed, you can go straight to the penile implant if that works best for your quality of life. I think I really like to emphasize it's not about my decision. I'm really trying to help you to achieve your goals. If you're more conservative and would like to start with oral medications, we can do that. Once we kind of progress through the treatment and we see what works for you, then we can kind of determine what the best treatment plan is. But I think it's really important to know all the options that are on the table and know that you don't necessarily have to stick with medications if that's not your forte. It's okay if you try the other treatment options first. So all of them are really equal in my eyes in terms of where we could start for your ED treatment. So for, the pills really have pretty high satisfaction rates. I would say for men that are taking the pills, well over 80%. The pills over time, depending on your health status, can really start to change in terms of efficacy, and so that's where the variability comes in. The satisfaction rates for the intraurethral suppositories are about 60%. I think for men that it works well, but certainly the satisfaction rates are a little bit lower than some of the other options. For the vacuum erection device, the data is pretty mixed in terms of the satisfaction rates there. I think some men are a little uncomfortable with sometimes the apparatus, and I think that actually impacts what they gauge in terms of satisfaction, but it works really well. And I say again, for guys who that works for, about 80 to 90% in terms of satisfaction rates. Penile injections or the intracavernosal injections also have pretty high satisfaction rates. If you are comfortable with administering, an injection via needle, it works pretty well. And so I think once you kind of overcome potentially the barrier of an injection into your penis, I think that's also a really high satisfaction rate. The satisfaction rates for penile implants are actually quite high, well over 90% for men and their partners actually. And I think it's really because you really have the power of an erection when you want it, on your own terms, and I think that really allows men to feel like they have more control and something that's as close as possible to their kind of natural, sex life as possible. The long-term consequences of not having erections, I tell my guys, the penis is like a muscle. You don't use it, you lose it. And so when you don't have erections, the tissues in your penis are actually really going to start to become a little hardened, a little less elastic and pliable. And so if I'm seeing a guy who perhaps hasn't had erections for a long time, the quality of your penile tissue just may be a little compromised. Not saying that we can't work with it, but it's actually pretty important. Once you see that that's becoming an issue, it's important that we start to target ways to maintain the quality of your penile tissue.